Welcome to This is Oregon, a podcast where we take you inside research happening at the University of Oregon and show you how it applies to your daily life. I'm Sherry Buray McDonald, your host for this episode. My guest is Ariel Williamson, an assistant professor at the Balmer Institute for Children's Behavioral Health and in the Department of Psychology at the University of Oregon. She's a national expert on children's sleep. We'll be talking about the importance of sleep and how children and their families can get a better night's rest.
Hi, thank you so much for having me. I'm excited to be here. So as you mentioned, I'm an assistant professor at the Balmer Institute for Children's Behavioral Health, but I'm also in the University of Oregon Psychology Department in the clinical area. So I'm a clinical psychologist by training, and then I have specialty training in behavioral sleep medicine, meaning I work with kids and families to change behaviors and feelings and mood to try to help benefit sleep. And that's what I do in my research as well. So I direct the Behavior, Emotions, Development, and Sleep Lab, or the BEDS Lab. Hope you love the name. But what we really try to do in that lab is take the evidence that we know about improving child sleep and make sure that it really can apply to all families across different settings. And by that, I mean really helping families who maybe they're working shifts, and so they're not always home in the evening, or maybe their child is developing differently and has different sleep needs. So all of that is, things we do in the lab. We partner with families, with pediatricians, with school professionals, and with mental health providers, like clinical psychologists, but also counselors and social workers to really help improve child sleep. And I first started being interested in child sleep when I was doing some clinical work in a pediatrician's office. I found that, families really wanted to talk about sleep in addition to their children's emotional and behavioral challenges. And sometimes sleep was really the biggest issue. And I thought, well, hey, this is really important. And I can't believe I don't know more about this. So I was fortunate to train at Children's Hospital of Philadelphia as part of my doctoral training. And then after I finished my doctorate in clinical psychology, and that really helped me understand how sleep is a modifiable behavior, meaning it can be changed and it cuts across all different concerns. If you have a physical health problem, a behavioral or mental health problem, neurodevelopmental differences, sleep is usually impacted. And so we can use sleep to really benefit overall child well-being.
So, Ariel, with a new school year starting up, why is now a good time to talk about children's sleep?
Great question. So with the new school year, we know that's a huge transition. Even if your child is going to the same school they were going to, it's going to come with new demands and, most importantly, a new routine. So usually over the summer, it's really typical, and at my household too, folks are staying up later, especially here in the Pacific Northwest, where it's lighter a lot later. And there's lots of fun going on. There may be vacations. Teens especially might be benefiting from the summer schedule, kind of falling asleep later, sleeping in later, but is more in line with their natural biological rhythm. But anyway, with the new school year starting, we got to get, somewhere at a certain time every day and kind of get back into that routine. And we know that routines are really helpful, not only for younger children, but for older children and even adults as well. And since sleep is so important for overall child well-being, now is a good time to think about just starting to modify your child's schedule a little bit and get back into that routine so that it's not such a big or abrupt change when the school bell rings on Monday or Wednesday morning or whenever your child starts school, which, they may have already started, or I know some people are starting in a couple of weeks.
So could you explain to us why sleep is so important for children's emotional regulation, learning, and overall well-being?
So I think it's important to consider sleep as a pillar of health, just like you would with, getting optimal physical activity and healthy eating. And what we know from lots and lots of research studies that look over long periods of time and also conduct experiments to manipulate or change child sleep is that when children, don't sleep for long enough, or they're having trouble falling asleep, they're waking up overnight, the next day, their emotions and behavior are really impacted. And so, for example, we can tell that when kids have had a poor night of sleep, most are, having trouble maintaining attention and really, being ready to learn. And usually, as well, when someone has like low mood, for example, or anxiety, that can also impact their ability to fall asleep and get back to sleep after night wakings. And we think that sleep and mental health are really bidirectionally related, meaning they influence one another. The same is the case for other, sleep and other outcomes like pain, for example, or other chronic illnesses. And sleep, we know, just impacts so many parts of the brain and the body. And so another thing we know is that, during sleep, especially in childhood, kids are really benefiting from deep sleep that they get from dreaming sleep. Getting enough hours of sleep is crucial for things like growth and hormone regulation, regulating your hunger cues, and sweeping out, memories that, we don't need and holding on to the ones we do. So research is still ongoing in that area, but overall, we have enough evidence to say that if you want your child, to be ready to learn and kind of regulated, getting enough sleep is important.
So, Ariel, you mentioned earlier that in the summer, families get on a more relaxed sleep schedule. What are some of the biggest challenges you see when it comes to kids transitioning from the summer schedule to school year routines?
A lot of the challenges I see are really related to timing. And so, as I mentioned, staying up later and sleeping in later is really normal over the summertime. But also consider, for kids making transitions such as from either preschool or kindergarten to the next grade level, they maybe, don't have the same afternoon schedule and aren't, having the opportunity to nap during the day. For older kids too, with school comes the expectation that you're, kind of quote unquote on all day. It's like, for us, if we've taken a vacation from work and then we come back, even if we were waking up and going to bed at the same time, there are different demands for our attention, our ability to regulate emotions, all of these different things. So with regard to timing, usually kids are having a really tough time waking up earlier and being kind of ready to go. Even if your child was attending camp or had a job, it may have had a more flexible schedule, or, they may be more or less excited to go to that particular, you know, requirement in the morning, for lack of a better word. So I think we usually see challenges with kids waking up earlier and kind of being either difficult to wake or super grumpy. And then at bedtime, a lot of kids have a hard time falling asleep earlier. So one thing to keep in mind is that usually it takes some time to change sleep, even by an hour. So for adults listening, if you imagine when you travel, if you're traveling to a different time zone, that can be really hard. It can be easier for some kids and families, but certainly for most of us, it takes some time to adjust, or when you think about daylight savings time changes. So you want to allow a couple of weeks for an adjustment. And it's helpful, I think, to start planning for that adjustment as much as you can. We know families are busy, but by gradually waking kids up a little earlier, and then eventually as they get sleepier earlier in the evening, starting to move that bedtime. But it's not all going to happen right away, and it may take some time.
I think a lot of listeners probably are familiar with people being grumpy in the morning, getting up. How common are sleep problems among kids, and what are the biggest issues?
Yeah, great question. I think, the biggest sleep problem, and it depends on how you define it, right? So first I'll talk about the problems identified by kids and families. So this is when kids and families are saying, hey, my sleep is a problem. Sleep problems like that, and usually that means kids who are having trouble falling asleep, might be having tantrums at bedtime, trouble like getting back to sleep after night wakings, or, feeling grumpy in the morning, having daytime sleepiness. Across ages, it's from about 20 to 40%. So that's a lot of kids at some point in their life are going to have one of those types of sleep problems. There are other sleep problems that, kids and families may not be as aware of, and that might be getting insufficient sleep. And that means getting less sleep than is recommended for a child's age. And, it's pretty typical for families not to know, for example, how much sleep their child needs at age 8. And we do have some resources we can share, but when researchers and doctors look at the rates of insufficient sleep, again, not getting enough sleep in a total 24-hour period, so daytime and nighttime sleep, we see that preschoolers who are usually napping as well, but even with the nap, about 30% of preschoolers are not getting enough sleep. That jumps to 50% in school-aged kids, and then up to 70% on school nights among adolescents. And usually we think that's because adolescents tend to have earlier school start times that don't align with their natural biological rhythm. And that biological rhythm or body clock shifts later when they go through puberty. That's one of our most robust or our strongest findings is that teens are not lazy. They're not, just trying to be night owls and stay up all night for no reason. It's really determined by a biological shift. And then also social changes like having more homework or more extracurriculars, just more things going on at night and more independence. So all of that taken together means that teenagers are really biologically predispositioned after puberty to fall asleep later and get up later. But when schools start really early, they tend to get poor sleep or insufficient sleep, not enough sleep before school starts the next day. And that's why it impacts about 70% of teens.
Yes, that's a high percentage. So how do you figure out how much sleep your children really need? And how does it vary by age?
Sure, great question. The American Academy of Sleep Medicine and the National Sleep Foundation have guidelines by age, and this goes from birth all the way to older adulthood, that they recommend. And these guidelines were based on research studies that doctors and other researchers reviewed. So as you're looking at those recommendations by age, generally, keep in mind that younger children tend to need more sleep and also tend to sleep more during the day. That's just part of their development. And then as they reach, school age, like starting kindergarten and beyond, sleep needs during the day should be reduced unless they're not getting enough sleep overnight. And then you may see your child being sleepy. And typically it's around 10 hours at age 10 and around 9 hours for teens. But I always caution families to keep in mind that every child and family are different. So you might be listening and saying, wait a minute, you just told me that not getting enough sleep is really bad for my kid. And so here are recommendations, but it may not apply to you. So yes, both things are true. So, we know that getting enough sleep is important. There are other factors too that are important with sleep, like quality of sleep. Does your child or you feel like they're sleeping well or not? Regularity of sleep, how consistent is the schedule? And all of those research studies that were conducted may not have included children that have the same characteristics as your child. So for example, children with mental health challenges or who have developmental differences may not be represented in all of those studies. And so really thinking about, okay, what do these guidelines say about how much sleep my child needs? How close are we to that? And then how is my child's daytime functioning? Looking at, do I think they really need more sleep based on their mood? Are they irritable during the day? Do they tend to become super energetic and maybe a little too active at night? And young kids, that can be a sign that they're overtired or need more sleep. And so really looking at your child and family and thinking through, what does my child need? And you may have to play around with it a little bit. And I always like to tell families that it's really not, hitting this specific target every night. It's doing the best you can to get your child enough sleep. And changes can be small. This might mean that you put your child in bed 15 minutes earlier. and you lay out things in the morning so they can get up 15 minutes later. And that's 30 more minutes of sleep. And we have studies that show that 30 to 60 more minutes of sleep really can have a benefit to next day functioning. So if you're looking at those recommendations and you're feeling a little anxious, I'm telling you, my child doesn't get the exact, optimal, perfect sleep every single night. We can't expect that. It really has to be tailored to you and your family.
Let's talk about bedtime battles. We hear about them mostly with toddlers, but can they happen with older children too?
Absolutely. Yes. So we have, toddlers who might be, crying, having tantrums, upset at bedtime. But with older kids too, you might hear that I'm not tired or it's still light out, which, wow, it really is still light out when school starts again in the evening. And so that can be really tough for getting kids back to bed. So I think, one thing to consider is what time have they been typically falling asleep. So with your older kids and teens, if, during the summer, they're usually falling asleep at, 11 o'clock, it's going to be really hard to suddenly get them in bed at 9 p.m. And so changing expectations and understanding that this might be gradual. Some families feel like, well, I can't have them, have an 11 o'clock bedtime when school starts. And I'm not saying it's forever. It's really temporary. Because if you put your child in bed at 9 p.m. and their body is usually, going to bed at 11, they're going to be awake anyway in bed, or you're going to have a battle, or you're going to have them popping out of bed or sneaking electronics or staying up in some way, or just laying in bed being frustrated. And we know that the longer you lay in bed awake, the more your brain thinks of your bed as a place of being awake, being frustrated, or doing other things instead of a place of sleep. So, when you're having those bedtime battles, especially with teens who, with puberty and puberty can happen as early as 9 or 10 years of age, it can start, consider, pushing bedtime later temporarily and making sure that you're waking them up at a consistent time. They may not be getting enough sleep for a few days or a week, but it's all part of shifting that sleep schedule a little bit earlier. So I think, looking at some of the resources that I know we'll share, Start Schools Later is a great organization that has really good videos for parents and teens about how the body clock changes as kids get older. But, again, talking with your child, depending on their age, right? Definitely don't try to reason with toddlers. We know that's a tug of war that you may not win, especially at nighttime. But with older kids, about their sleep schedule and kind of how it's changing and getting somewhere where, it's more in line with their body clock, but they're still able to get enough sleep. And I know, again, that might sound like impossible, but here I'm saying making really small changes and then gradually moving bedtime earlier when they're starting to be sleepy earlier because they're waking up earlier in the day.
Thanks. That actually sounds doable. So we've talked a lot about how many children there are that have trouble sleeping. What does the research say about the causes of poor sleep?
I think as with anything, it's no one factor, right? So it's a number of different things that can cause poor sleep. And, when I'm going to talk about sleep problems here, I'm really going to talk about those difficulties falling asleep and then frequent wakings and having trouble getting back to sleep. So, with the causes of poor sleep for those problems, it's really a lot of different environmental and family factors. And by family factors, I am not blaming families here. It's not family's fault. I see a lot of kids and families where parents are feeling really guilty when they come and see me and they say like, oh no, did I ruin sleep? I let them watch TV at bedtime, or I, was sharing a bed with them until they were 4. Is this my fault? It's not parents' fault. We may have some kids who are more sensitive to the environment, and so they, tend to need more help getting to sleep and have to actually learn, how do I fall asleep on my own at bedtime? Or they may have worries and fears at bedtime, and so working on those sorts of things can help with sleep. One thing that parents should keep in mind, and other caregivers, is that whatever you need to fall asleep at bedtime is what you need to get back to sleep overnight after normal night wakings, which happen 2 to 6 times per night. Even if you don't remember, if you're like, I slept through the night, I promise you, your brain woke up. But your brain's going to wake up a lot more if the environment has changed. So, for example, for a kid, if they fell asleep with music and their light projector on, but the light projector and the music turned off, overnight they may be looking for those same things to turn back on to get back to sleep. It's the same thing with parents. So if you're laying with your child to help them fall asleep at bedtime, they're going to be more likely in the middle of the night after a normal waking to come and get you to have that same thing happen when they need to get back to sleep overnight. And that doesn't mean parents are doing the wrong thing. But when this is hard for them and families are feeling like, I want my child to be able to get back to sleep, usually that's when mental health providers and pediatricians can be really helpful. But I think back to the causes of poor sleep and trouble falling asleep, or waking a lot overnight and needing help to get back to sleep. Really, we know that as I said, many different things, but also mental health concerns, for example, daytime anxiety, low mood, attention problems. All of those issues are related to poor sleep and kind of go hand in hand. So mental health challenges, environmental stress, so things inside of the home, like if it's loud or noisy, or families are struggling with work or getting homework done, or they're stressed, but also things outside of the home. And that's can be really hard to control. If there's a lot of light or noise in the neighborhood. Sometimes I work with families on using things like eye masks or earplugs if it's safe. A lot of people do blame electronics for a lot of things for kids. I'm of the mindset that electronics certainly can cause kids to fall asleep later just because they're stimulating, right? They have content. For some kids, the light from electronics can cause them to fall asleep later. But it's really also the things they're doing on the electronics devices. But we also know from newer research that kids with sleep problems may use electronics as a time filler because they're having trouble falling asleep. So it's not always electronics that are going to be the main source of the sleep. So I think, really thinking about all the different causes, but also it could just be that, your child is having a tough time. We know that for adults, like when I have a big deadline or I'm nervous about teaching a new undergraduate class, right? I might have poor sleep for the weeks leading up to that because of stress or anxiety, or, after I've been sick. All these different factors can cause poor sleep. And we like to say it can be like a cold, and it comes back during times of stress. And so keeping an eye out for stress and really trying to take the blame off yourself as a family and moving towards solutions and getting help are things I recommend.
How does anxiety or stress, like starting a new grade or facing challenges at school, affect sleep? And how can families help children manage that?
So a couple things that families can do to help, when there's a big transition, talking about it with your child during the daytime can help. And some families can have like a worry time where they set a timer, and this is well before bedtime, maybe before dinner or after dinner. If you have 5 or 10 minutes to write down all the things they're worried about, or talk about how they're feeling, and then think about ways that they can cope with that. So it might be, having a bedtime routine that ends with a child doing some relaxation strategies, visualizing a scene that they like, talking with their family about what they're going to dream about, or thinking, thoughts about coping, like I've started a new grade before. I'm going to start this grade again and we'll get used to it. That's harder for younger kids. Younger kids need a lot more parent or caregiver support with that. But I think just understanding that transitions can be challenging, and that if, you're starting to see, even with some of these things you do on your own, that your child's having a tough time at home, at school, or both, really reaching out to get some help from a provider is beneficial at that point.
When should a parent consider seeking additional help for their child's sleep, and what kinds of supports are available?
Great question. I think anytime that a parent or caregiver is feeling like sleep is a problem, like their child's having trouble falling asleep, or they, don't want to have to help their child get back to sleep overnight. And again, I just want to pause and say some parents are okay with that, and that is totally okay, right? So it's a problem, for parents. I'm not saying, if you're sleeping with your child overnight, if they're an older child or you're helping them get back to sleep, if you're okay with it, that's okay. But if you're not, and you're feeling like your child's having a really tough time falling asleep, they're waking up too much, or, they're having trouble during the daytime, like they're sleepy during the day or really irritable and also having these sleep problems, it would be time to get some help. One thing that parents also, or families, caregivers may not know is that when kids are snoring, it's also a good idea to talk to their child's doctor. For older kids, this is tough because you may be like, I don't know if they're snoring or not. But you can ask your child, or if they're sharing, a room with any sibling or at sleepovers. But snoring, is something to bring up with your child's pediatrician, especially if it's happening 3 or more nights per week when your child is not sick. That can be a sign of sleep disordered breathing, which is, a range of difficulties that range from snoring to things like gasping and pauses in breathing overnight, and should be treated by a medical doctor. So, snoring, and then these types of sleep problems that I've mentioned, if your child is sleepwalking or waking from sleep with a really loud scream or having really frequent nightmares, all things to seek some support from. The first line of support is your child's primary doctor or pediatrician. Your child's pediatrician may have some great resources to help with sleep. And then if a specialist is needed, they can refer you to, and either for, things like trouble falling asleep or frequent wakings. If your child's also having anxiety or low mood or attention problems, it would be a good idea to visit with a mental health professional. There are also sleep doctors, and that includes medical doctors that have specialty expertise in sleep, as well as psychologists like myself and nurse practitioners who may have specialty sleep training. Those folks are usually available at children's hospitals, in sleep centers, or in the outpatient mental health programs for the behavioral health providers like psychologists, and social workers and counselors.
Good to know. If listeners take away just one thing from our conversation, what would you want it to be?
That for sleep, one size does not fit all. You may be hearing a lot out there. And I shared a lot, like, here's the optimal, number of hours your child should be getting. Or, if someone's saying electronics are, the cause of all sleep problems, get them out of the bedroom. And you're thinking, well, that's never been a problem for me. Or like, is it? One size does not fit all. Every child and family are different. And sometimes, it may take working with a doctor or a mental health provider, or, another specialist to really tailor or adapt those interventions or strategies or recommendations to your specific family. So I really like to encourage caregivers and parents to take some guilt off and really not blame themselves, and know that sleep is complex. Yes, it's an important pillar of health. We know that it's related to just about every part of child development, but it's a moving target during childhood. Sleep is going to change a lot during development, and recommendations, are not hard and fast rules. I think this is something that families, will really want to take in the context, or by that, I mean with, their own family and environment in mind, to really promote healthy sleep in a way that works for them and their family.
Where can listeners get more information about healthy sleep or about the work you're doing at the U of O?
So I think I'll share some resources today, and I mentioned some of them. Start Schools Later for older children is a great resource, and we'll share the link for that. Kids Health is also a great resource with material or information that is relevant for kids to read, teens to read, and parents or other caregivers to read. I'm also part of the Pediatric Sleep Council, and we're at www.babysleep.com, and we give free evidence-based, meaning science-informed advice for sleep in children ages 0 to 3 years. And that includes tips and tricks and things like mobile apps that can help parents manage child sleep. And then, of course, there's more information and healthy sleep recommendations at my lab website, the Beds Lab, which we can share as well. But certainly talk to your child's doctor if you have questions about your child's sleep or need more support. And just remember, it's a moving target and one size does not fit all.
Thank you for joining me on the podcast, Ariel.
Thank you so much for having me.
This is Oregon is produced by the Division of University Communications. For more of the latest University of Oregon research and news, visit news.uoregon.edu or find us on your favorite social media platform using the handle @uoregon. Thanks for listening, and go Ducks!